Exploring text messaging as a game changer for cancer patients' fitness. A deep dive into the evidence. Imagine battling cancer and struggling to stay active, only to discover that simple text messages could be your secret weapon for boosting energy and health. But here's where it gets intriguing. Does this low-tech approach really stack up against traditional methods? Xueyan Chunwan, MD, https://www.jmir.org/search/search result field %sign 5b %sign 5d equals sign author ampersand criteria %sign 5b %sign 5d equals sign Xueyan plus Chung. Muxing Ho 1, PhD, https://www.jmir.org/search/search result field %sign 5b %sign 5d equals sign author ampersand criteria %sign 5b %sign 5d equals sign Mu-Xing plus Ho. Chun Kit Chan 2, MSCI, MA. https://www.jmir.org/search/search result field %sign 5b %sign 5d equals sign author ampersand criteria %sign 5b %sign 5d equals sign Chun %sign 20 Kit plus Chan. Denise Shupting Chunwan, PhD, https://www.jmir.org/search/search result field %sign 5b %sign 5d equals sign author ampersand criteria %sign 5b %sign 5d equals sign Denise %sign 20 Shup %sign 20 Ting plus Chung. 1 School of Nursing, Li Ka-shing Faculty of Medicine, University of Hong Kong, 3 Sassoon Road, Pak Fu Lam, Hong Kong, China. 2 School of Continuing Education, Hong Kong Baptist University, Hong Kong, China. Corresponding author. Denise Shupting Chung, PhD. Email. denise.chung@ku.hk. Abstract. Background. Plenty of studies highlight how staying physically active can greatly benefit those dealing with cancer, from enhancing quality of life to reducing symptoms tied to treatments like fatigue or shortness of breath. Yet, shockingly, most cancer survivors fall short of the recommended activity levels. Think 150 to 300 minutes of moderate exercise or 75 to 150 minutes of vigorous activity per week. Text-based messaging on mobile phones seems like a promising, accessible way to encourage more movement, but no one had yet compiled a full review of its impact specifically on cancer patients' physical activity. Objective. Our aim was to conduct a thorough evaluation of how interventions relying on mobile phone messaging can influence physical activity levels in individuals with cancer. Methods. We carried out an extensive search across 8 databases in English and Chinese, including PubMed, Embase, Web of Science, Medline, the Cochrane Library, Scopus, Wanfang, and China National Knowledge Infrastructure. We focused on randomized controlled trials that tested the effects of mobile phone messaging-based programs on physical activity in cancer patients. To explore any significant variations, we performed subgroup analysis based on patient traits like age and treatment stage, along with details about the messaging strategies and how activity was measured. We employed random effects models to calculate overall effect sizes. 2 reviewers independently evaluated the risk of bias using the updated Cochrane collaboration tool. We also ran sensitivity checks, such as leave one out tests, outlier removal, and analyses limited to studies with low or moderate bias. Finally, we checked for any signs of publication bias. Results. Our review included 13 studies with a total of 777 participants. Right after the interventions, messaging programs led to a modest but significant increase in objectively measured physical activity, standardized mean difference, SMD, equals 0.37, 95% CI 0.10 to 0.64, P equals 0.007, I superscript 2 equals 0%, but no notable effects on self-reported activity. SND equals 0.20, 95% CI minus 0.07 to 0.47, P equals 0.15, I superscript 2 equals 56%, or step counts, SND equals 0.27, 95% CI minus 0.19 to 0.73, P equals 0.25, I superscript 2 equals 69%. Programs incorporating more behavior change techniques and aimed at patients who had finished their active cancer treatments showed stronger results for step counts. Interestingly, at follow-up assessments, the benefits for self-reported, objective, and step count physical activity were no longer evident. None of the studies had low or moderate risk of bias. Sensitivity analysis and trim and fill methods supported stable outcomes from messaging. We found no clear evidence of publication bias. Conclusions: text messaging interventions appear to offer a practical option for slightly enhancing objective physical activity in cancer patients, although the impact varies and remains limited for self-reported measures or daily steps. Evidence on lasting effects over time is still sparse, underscoring the need for more robust studies with longer tracking periods. Trial registration: Prospero CRD 42024557519, crd.york.ac.uk/prospero/view/crd 42024557519. J-Med Internet Res 2025, 27, E73934. doi 10.2196/73934, https://doi.org/10.2196/73934. Keywords: cancer, physical activity, mobile phone messaging, systematic review, meta-analysis. Introduction. A wealth of research shows that keeping up with regular physical activity, PA, can be incredibly helpful for cancer patients, boosting their overall well-being, improving cardiovascular fitness, supporting mental health, and easing side effects from treatments like fatigue and breathing difficulties. Despite these clear advantages, it's disheartening that only about 70% of cancer survivors manage to hit the PA guidelines after diagnosis, those being 150 to 300 minutes of moderate intensity exercise weekly or 75 to 150 minutes of vigorous activity. This shortfall is often linked to challenges unique to the cancer journey, such as disease progression, the demands of therapy, and related symptoms like tiredness and shortness of breath. Past efforts to encourage PA in cancer patients have largely involved in-person approaches. While effective, these methods come with practical hurdles, like scheduling conflicts, accessibility issues, and long travel distances. In recent decades, though, digital health tools, including mobile apps, wearable trackers, and messaging services, have emerged as viable alternatives for PA promotion in those with cancer, offering convenience, broad reach, and affordability. To break this down for beginners, mobile phone messaging acts as a bridge between users through various digital channels, such as SMS texts, multimedia messages, or instant chats, allowing for quick, real-time sharing of ideas. These messages can be one-way or interactive, generic or personalized, and sent at different frequencies. Unlike more complex apps or web platforms, messaging stands out for its wide accessibility and doesn't require much tech savvy. Moreover, it's an excellent vehicle for implementing behavior change techniques. Think strategies like setting goals, tracking progress, and providing feedback, which are essential for helping cancer patients adopt healthier habits. Previous reviews have shown that mobile messaging can aid other health behaviors, such as quitting smoking, managing blood pressure, and controlling weight. However, findings on its role in boosting PA have been mixed, with no clear benefits in those with type 2 diabetes and positive results in the general adult population. While some reviews have examined broader